Good morning, I'm Kaur Vimana, in charge nurse here. How can I help you?
Well, nurse, actually, I'm really concerned. Rather, I would say, I don't know, I'm feeling a lot of anxiety for my father. He has just been admitted in the hospital 4 days ago, and
Okay.
at that time, he was he had a severe heart attack. And doctor told me that he is absolutely fine and he could be discharged yesterday. But that has not happened, so I'm really concerned about the same thing.
Okay. Please do not worry about this thing.
Well,
Firstly,
nurse, it's very hard for me. I love my father so much. He's the only one who is with me and who has helped me in every situation. He's like my best friend. I just can't afford to lose him, and I'm really concerned.
could you please tell me the name of your father so that I can explain each and everything about the condition
Oh,
of your
that
father?
is Mr. John, nurse.
Okay, thank you. As I can see from the notes of your father that he is now out of danger, that he is now
Well, I know that, Miss Behant, and I could actually, realize it when doctor told me yesterday. But then, when he was supposed to discharge yesterday, why he wasn't discharged? That means there is something wrong with him. And doctor told me that he is now suffered from something called UTI, and I don't have any idea whatsoever about this particular problem as well. So I just really would like to know what's going around, and I'm really getting really worried that it might be another heart attack.
well, please do not worry about this thing. I certainly understand your concern about your father. Firstly, I would like to tell about the UTI, that is the urinary tract infection.
All
It is a
right.
kind of infection that can happen with any person at any stage, and it is not related with heart attack.
Isn't it related with heart attack?
No, not at all.
Well, but like maybe that can lead to heart attack in some cases. Like, is there any possibility of that?
No, there is nothing like this. No, it is a kind of infection that is no relation with the heart attack.
All right, but don't you think that the patient who has just gone through a heart attack and then he is having that infection, maybe that can some can lead to some kind of a triggering factor, or maybe can lead to some serious consequences.
Well, I certainly understand your concern, but there is anything that will correlate with these UTI infection and heart attack. Both things are
All
very
right.
different.
Well, nurse, I don't know how to put it up, but I just want to tell you that I really love my father, and you know, finding him in trouble and going through all these phases is really difficult for me. I just want that the best treatment should be provided to my father in any case.
Well, sure, we have a best team of doctors in our hospital and a very well trained staff. So please do not worry about this thing. Your father would be absolutely fine by the end of this week.
All right. So by the end of this week, I was about to ask, like, how much time? Like, do you really think he would be absolutely fine after a week?
Yes, he would be fine.
All right, nurse. In that case, I would say that's all right, and I really want just him to feel better, so that so that he can be all right and he can feel his comfort zone again, because finding him in trouble is again very difficult, and that too I am living in a hostel, so that makes me even more concerned about my father, because I cannot stay with him all the time. So it would be
Yes.
great if you could provide him the proper treatment and can make him recover completely.
Well, I certainly understand that it's very hard for you to correlate all the things in a day or in your life.
True, I was absolutely stunned when my I was in the hostel, and when I was told that he suffered from a heart attack. It was really kind of shocking news. I just could not even you know take a proper breath for like 10 to 15 minutes. It just everything stopped for me.
Well, I understand. And could you please tell me one thing, and that I already told you about the UTI infection.
True.
Could you please tell me that does your father faced this kind of infection at his stage?
Nurse, I'm not quite sure because I'm residing away from him. So it might be there, but he never talks about anything that is not really bothering him. He just shares whatever bothers him. That's why I love him the most. He's a very selfless person. So I cannot be sure about it.
Okay, all right. I hope you understand my point of view.
Yes, I have
And
understood everything.
please do not worry about this thing, as your father is now out of danger.
Alright.
That is related to cardiac attack,
Alright.
and now he is suffering with UTI, and it will be also treated with the medication as prescribed by the doctor. And I hope
Sure, nurse.
the recovery will be done. Will be
Recovery will be absolutely fine.
recovery will be absolutely fine.
Alright, thank you very much, nurse. Thank you.
Okay, thank you.
Thank you.